And all right. And it's nice to see some familiar faces. Welcome to everyone. Again, I'm Elisabeth. I'm the nurse practitioner in memory and brain wellness. My role here is working with people. Most all of my patients have dementia. And my goal for this talk is that you will come away with some tools to survive, also some ideas about how to cope, and then even some ways to really thrive during this really difficult time. So this is news to no one. If my brother were here, he'd say, hello, Captain Obvious. We are all susceptible to catching COVID-19, also known as the novel coronavirus, and we all need to be taking special care. As we also know, COVID-19 can cause serious illness, not in everyone, but we know that older adults are at greater risk, as well as people who have a history of heart disease, lung disease, and diabetes. So some of the things that we can do to help protect ourselves and to protect our loved ones. One of the major things, I'm sure you've all heard this already, is washing hands. And we know that some people who have dementia really don't like water and soap. And so I think it's really great to get creative. Some of the things that people have tried is like having just a bucket of soapy water and something to wash. That can help people really take those 20 seconds that's recommended to get your hands clean. And I do think that it's important not to make perfect the enemy of the good here. So less time than 20 seconds is still good, and it's better than not washing hands. Another thing is if soap and water is just not gonna happen, hand sanitizer is okay. Soap and water are best, but it's still good and better than not washing hands. And so hand sanitizer, if you can find it right now, at least 60% alcohol content is best. And then I'm hoping that during this talk, you all are really watching the screen of the slideshow and not watching my face, because I'm terrible at this. But it is a good idea to try to avoid touching our faces, our noses, our mouths, our eyes, especially if our hands haven't just been washed. Some people find that strategies like wearing gloves or wearing a mask are a good reminder to not touch our faces. Though these do not take the place of hand washing, so they shouldn't keep us from continuing in that goal to keep our hands clean. Another thing that we can do that I'm sure you all have heard about already is that we can all stay home. Home is the safest place to be, so if you can, stay there. Another thing that has been in the news quite a bit lately is whether or not to wear a face mask. And I just checked before this talk, and it's still true that the CDC says wearing a face mask in public is not recommended unless we're sick, and that doing so really protects other people, and so we don't need to if we're practicing social distancing. This is really being debated, so I would say experts disagree about this. So stay tuned. These recommendations may change over time. One thing though that is not being debated is that N95 respirators are in short supply and should be saved for frontline healthcare providers. So if you happen to have a stockpile of N95 respirators, you can donate unused, unopened boxes of them. UW is accepting donations, and lots of hospitals in the area are. So you can Google in-kind mask donation and then the name of the hospital, and there'll be instructions about how to go about doing that. That said, if you feel safer being in public wearing a mask, it's okay to wear one as long as it's clean. It may protect a little bit. I would say though, if our loved ones with dementia don't want to wear a mask, or if it means that they're touching their face more, it's okay. You may want to reconsider and just forego the mask. And I want to say just one more time, even though I've already said it, that wearing a mask doesn't replace hand hygiene or social distancing. Those are really the two most important things to be doing now. Okay. Other things that we can do are just taking care of our health, all the things that we know of, staying well hydrated, getting rest, eating well, keep taking medications, keep administering medications. Pharmacies and insurance companies and providers are being very permissive right now about providing refills. So if it's been a while since an appointment and you usually would have had to be seen to get a refill, ask for one anyway. No one wants a non-urgent clinic visit right now. And that leads me to my next bullet point, which is to stay away from sick people. If you need to go see your provider, if there's something that's coming up that you need help with, many clinics are offering telephone or telehealth visits, so ask your provider if this is an option for you or your loved one. And if you do have a telehealth visit or a telephone visit, you get bonus points if you have at home a digital thermometer, a home blood pressure cuff, a step-on scale, and or a pulse oximeter. Especially if you're having any symptoms or your loved one is this type of information, basically vital signs, can really help your healthcare provider provide the best care and make a good plan for how to manage any symptoms. All right, so talking more detail about social distancing. I think we all know by now that social distancing is not easy for us humans, and people with dementia, of course, included in that. So some of the things that we all should be doing is not hanging out with our friends and family, avoiding large groups, and just really trying to stay at home as much as possible. Those times that we are in public, some of the strategies that can be helpful for our people with dementia are playing a game, using all of the tools that we have to distract from that cute puppy or that baby that you normally want to talk to. And then just thinking about how to prevent issues as much as possible. So if that means going to the grocery store when there's hardly anyone else there, or when you're taking that walk, driving a little further to go somewhere where there aren't going to be a lot of other people, so that you can avoid this kind of situation. And I would say that if an awkward situation does happen, what I would do is I would try to let the stranger know that I'm trying to follow the guidelines. And I can be indirect about that and hint that my loved one has an impairment without really shaming them or making my loved one feel bad. So one example is I could say, oh, Mom, I'm so sorry I forgot to tell you that we're not supposed to be around other people right now because of this bug going around. And it's been my experience that strangers can be much more gracious if they understand that someone has a memory loss. All right, so I'm hoping that no one is experiencing any of these urgent issues presently, but I do think it can help all of us to know what is an urgent issue and what should I do about it if it should arise. It can help us all feel just a little calmer about this pandemic. So my recommendations are that if you or your loved one is having trouble breathing, having chest pain, if lips or face turn bluish, if speech is slurred, and if you as the care partner are feeling confused yourself, to call 911. So reasons to call a primary care provider instead. First would be if I or my loved one was having a fever, new cough, body aches, new shortness of breath, or if my loved one has a sudden change in alertness, memory, or level of function. And the reason to call your primary care provider instead is because there are a lot of things that can cause these symptoms. It doesn't necessarily mean that this is COVID-19, and some of the things that can cause these symptoms can be treated and can keep people out of a situation where they're going to be exposed to a lot more sick people. Sometimes, you know, people can have COVID-19 and not need to be hospitalized. So it's really important to talk with your primary care provider, tell them all the details about what's going on, and so that he or she can help with the next steps. Some of the other things to really consider right now before urgent issues arise is who would I call if I were a primary caregiver if I needed to be hospitalized? Is there someone that could take over the care of my loved one? Another thing to consider now are, what would my options be if I were to get sick and I didn't need to be hospitalized, but I wanted to isolate myself if I could from my loved one to keep them from getting sick? For some people, that's just not an option. And so some of the things to be thinking about, if I was sick and I was also trying not to keep other people in my household sick, I guess this first bullet is more about, okay, if I was feeling sick and I had to leave my house, the really important recommendations are to wear a mask, stay 6 feet away from other people, and to not take public transportation. This really begs the question though, do I really have to leave home? Staying home is really safer for everyone. So think about things like getting food and groceries and prescriptions delivered. Other really important things if I'm sick or if my loved one's sick is to cover coughs and sneezes, keep washing those hands, don't share items like silverware or taking bites of each other's food, for example. Another thing too is disinfecting high-touch surfaces every day. So things like doorknobs, the phone, bathroom fixtures, remote control, tables, counters, and that refrigerator door handle. The deliveries and covering sneezes and disinfection, those are all things that are good for all of us to be doing, not just if we're sick, but especially if one of us is sick. All right. So I wanted to talk a little bit too about preparing for a situation where someone might get really sick. And this is something that maybe some of you have already thought about and already made a plan for your advanced directives. For those of you who haven't done this yet, I would make a plug to think about this now. And that's because these type of decisions are much harder in the midst of a health crisis. And everyone benefits from clarity beforehand. I'll give you some good sites at the end of this talk that our social worker pointed out for us, Karen Clay. But the things to be thinking about are really what matters to me and what does quality of life mean for me and my loved one. How much and what type of care would I want? And some of the specific questions are, you know, if I got really sick, would I want to go to the hospital? Or if my loved one got really sick, is that an option that I want to take? And if in the hospital, would I consent to go to the ICU if I got really sick? And would I consent to being hooked up to a breathing machine or intubated? And then also a feeding tube, and do I want to get CPR if I was not breathing and my heart were to stop? And I don't think that you have to answer all of these questions at this point. I think asking for recommendations from people that you trust, who know you well, or who have experience in this situation can be really helpful. And again, these sites that I'll give you at the end can be also helpful in just walking through what's important to you and how that can inform the decisions that you make. Another piece of this is choosing someone who would make a decision for you if you weren't able to. Best case scenario is choosing a primary person and then choosing a person who's a backup. And then the last part of this is just letting friends and family and the people who need to know what your decisions are, making sure that they know. And so in that same vein, I recommend taking the time now to keep an up-to-date list of medications and chronic conditions, my allergies, my primary contacts, and along with my advanced directives, and keeping them in a place where I'll have them in an emergency situation. So if that means my purse, my wallet, or taking a photo with my smartphone. All right, so this next piece is about communication and explaining social distancing. I don't have a lot to say on this topic, but I do know that there is a lot out there right now in terms of virtual education. TIPA Snow, the Alzheimer's Association, the Alzheimer's Foundation of America, and other memory clinics across the country have put out some really great videos. This phrase about explaining social distancing to people with dementia is one that I think I heard from TIPA Snow, and that is, "This is how we stay safe right now." And I really like this phrase because I think it follows these important principles where we're giving only the amount of information that is really needed and only the amount of information that's really being requested to people with dementia. I think that this is a way to protect them from the onslaught of the news right now. And I think that's important. It's important to protect our own selves too, and not get too inundated, because it can be very overwhelming and cause more harm than good. It's good to stay updated, but it can really ramp up our anxiety. I think the principle for every discussion or every answer, not just in the midst of this pandemic, but also in life, in working with people with dementia and living with people with dementia, is that the underlying message is that you're safe, known, and loved. And so saying things like, "We're doing everything we can to keep our family healthy," is in that vein of just remaining calm and reassuring. And so it can be really difficult to feel like we're safe right now. Anxiety is a normal thing in this situation. I think people who aren't feeling anxious aren't maybe watching what's going on. Lisa Moore is a psychologist who has contributed to some of the UW staff support messaging, and she said this, that anxiety is normal and can help by alerting us to the need to protect ourselves and our loved ones. And I really liked that. I think that right now it's good to embrace the parts of us that are anxious and let that part of us know that we're listening and that it's going to inform our behavior. But it's important to recognize there are other important parts of us too that deserve attention, and that the anxious part of us is not the part that's in charge. I think it's also really important to think about and notice all of the good things that are happening right now. I think that can help us stay balanced. Some of the good things that were before this pandemic were really unheard of, like people being nice to each other on the internet, for example. Other things that can help give us hope in hard times are daily routines, and they can help by limiting how many decisions we have to make each day, and helping us to have a sense of control. Another thing that we think of every day, but especially right now, is just doing fun things together every day. So for this slide, I chose this photograph of a couple of dogs that are King Charles Cavalier Spaniels, and all it takes for me to feel a little bit of joy is to see a photograph of these cute little dogs. And you know, the internet's plastered with them, and it can just be a couple of minutes or a couple of seconds, and it can just make me feel a little happier. So finding joy for yourself, the things that really do that for you. So another thing that we all are thinking about is asking for and accepting help. And so for some of us, this is really hard, and I would say that now is the time to be working on it, because there's a lot of ways that we can't reduce our stress level, which means that we need to increase our support level. And there are many barriers to that right now as well. Adult day centers are closed. Some caregivers are not able to come to work. And so thinking about ways to be creative about it, online support group, using technology, excuse me, online support groups, asking family and friends to check in with us virtually on a regular basis, reaching out to your therapist or establishing care with a therapist. Most, I think, are doing virtual visits right now. Reaching out to care managers, they can be very, they can give really great advice. Reaching out to your faith community, and I think we've all seen these lovely videos of neighbors who are, you know, practicing social distancing and doing incredible things like celebrating birthdays or serenading each other. So this next bullet point is another one that's pretty obvious to all of us, but especially to caregivers of people with dementia, but that is that managing our own stress level is important to our loved ones, and especially to our loved ones with dementia, some of whom can just be uncannily sensitive to our moods and are really good at picking up on nonverbal messages. So some of the things that have helped other people really get to that centered place and manage some of the stress is meditation, prayer, exercise, having a quiet space, watching the jellyfish cam, just laughing. 2 minutes of any of these activities can make a difference. Another thing that I think about is adjusting our expectations. Being gracious to ourselves. It's okay if we're not meeting our highest life goals right now. Also, forgiving ourselves for the times that we haven't been nice. Try to acknowledge our own distress so that the next time I can respond instead of lashing out. And then all of us just giving ourselves some credit for how hard we're trying, because this is hard. I think having compassion for ourselves, for others, and our loved ones with dementia is a powerful thing. And when I say compassion, I'm talking about recognizing our suffering and recognizing the suffering of others, showing concern for that suffering, and then being able to relieve that suffering as much as possible. One of the amazing things about kindness and compassion is that they can go viral too. And they're a way that suffering, instead of isolating ourselves, can connect us to other people. I think being a caregiver for a person with dementia is being part of a tribe. So I think of this as we're all in this together, none of us is alone. All right, so I've made it to my last slide, and this slide is all about some good resources during this time. And I want to point out right off the bat that Facebook is not on this list. Facebook's a great way to connect with other people, but don't believe everything you read on there. Some other places to really get good up-to-date information is coronavirus.wa.gov, the Department of Health, doh.wa.gov, and cdc.gov. Another place to get dementia-specific information right now is through the Alzheimer's Association website, or you can call their 24/7 hotline at 1-800-272-3900, especially if there's something specific that is happening that you really need some help problem solving. The Alzheimer's Association has social workers who are there to answer the hotline. Another resource that we found is through the Penn Memory Center at their website, pennmemorycenter.org/COVID-19. The first section of that website is about their clinic, but if you scroll down to the stay-at-home survival guide, they've got some really great tips and some ideas too about how to just have fun together every day. And then those websites that talk about what are the things to be thinking about in preparing advance directives. One is prepareforyourcare.org, and another one is theconversationproject.org. And then last but not least, our website, Memory and Brain Wellness. As Mary said, there's upcoming talks every Wednesday and Friday, 1 to 1:45, except for one time at 10 o'clock. So check it out. And I think I'm done.